My name is Martin Fisher, and I'm a commercial fisherman and in the seafood business. I had been shrimping out on the bay the night before and hadn't had a lot of sleep, so I slept in a little bit that morning. The pain just came out of nowhere, and it felt like it was the worst pain in my life. And the pain got so intense I couldn't stand up. So I took 4 baby aspirin and sat down in an easy chair and called 911.
When he came to the front door, he had what we call sometimes when you knew this for a while is he had the look. So he was pale, his skin was cool, diaphoretic, had substernal chest pain, said he was having shortness of breath. All these are signs, these are all buzzwords going off in my head saying this could point to a cardiac event.
And they told me I was having a heart attack. I said, I want to go to St. Anthony's.
He was having a STEMI. So as soon as we found that, we notified St. Anthony's Hospital immediately. We can also send our 12-lead data from scene to the hospital. When we did that, they activated their cath lab.
In order to cut time, in Martin's case, in other cases, when appropriate, we just bypass the ER altogether. And if we know that it's a STEMI or a heart attack coming from the field or outside and the paramedics know it's a STEMI, we just go directly to the cath lab, and that saves considerable amount of time.
There was quite a few EMS who brought him to the cath lab, and then they stayed and watched.
Sometimes things get lost in translation if we don't go with them. So being a patient advocate, and the way our philosophy is we stay with the patient until transferred. Once we got to the cath lab, we were able to transfer all information needed, and we stick around because being patient advocates and bought in, we wanted to see how things went.
We found the blockage. It was the LAD, which is the artery that goes in front of the heart. It was 100% blocked, and we quickly opened it with a stent. 60-minute door to balloon time is the recommended time, and we were way below that with 26 minutes. And because of the quickness, that's why his heart function is completely normal now.
Cholesterol is a genetic high marker in my family, and I resisted treating it for many, many, many years. Sometimes it's better to listen to the doctor.
To prevent a heart attack, you need to control the risk factors, which is if you have high blood pressure, control your hypertension, take your medications for that. If you have high cholesterol, take a cholesterol medication. Of course, diet and exercise are important too.
Emotionally, it was really hard in the beginning to accept that I was going to be okay.
A factor that was positive in his case is that we did the procedure here in St. Anthony Hospital. It's a good team. It's a very cohesive team.
I will say working here at St. Anthony's, in the cath lab, the culture that has been created here is incredible. We collaborate with each other, which is so important for us to be able to work effectively here in the cath lab and be able to have good patient outcomes.
I'm in an amazing place now. The team was fantastic. You couldn't dream up a better team. The best thing I could possibly say to the team is thank you for saving my life.